going to be starting in 5, 4, 3, 2,
We're good.
1.
Good afternoon to everyone in our community who is listening in today to our Public Health Board meeting. Many of you have asked me personally, and I'm sure many members of the board have been asked this, what in the heck does the Public Health Board really do? The most important thing we focus on is working with each person in our community and our community at large to promote health and, most importantly, prevent disease by protecting and enhancing our environments, our policies, and our systems that support positive outcomes for everyone. And with that said, I do want to thank everyone in our community for all of the social distancing and for your attendance to teach the public and work with the public, because I am so very proud of everyone here and everyone in our community who continue to practice social distancing. I'm seeing a lot more individuals now doing facial coverings. Again, all of this is very important so we as a board can begin to think about relaxing some of our orders. But those orders are only going to get relaxed. You need to stay the course and do it very cautiously and with a great deal of mitigation. So with that said, we're going to introduce each member of the board and then the alternates to the board. I'm Marky Butler. I'm the mayor of Snowmass Village, registered nurse and a hospital administrator by training. So I'm really, really honored to serve in this capacity. And now I turn it over to our vice chair, Greg. You want to introduce yourself?
Yeah, hi everyone. I'm Greg Postman. I'm a Pitkin County Commissioner, District 3 in Pitkin County, and I am the co-chair of the Board of Health. Thanks.
Linda, I see your face. Linda? Unmute.
Hi, I'm Linda Vieira. I'm a nurse midwife and advanced nurse practitioner in women's health. I've lived in the Valley for 43 years, and I work at both Community Health and Aspen Center for Women's Health. Thank you.
Tom? Unmute.
Tom, you just muted yourself. Sorry.
There he goes.
Okay.
Do you hear me?
Mm-hmm.
I went from Denver to Dallas in 1978 and helped found the Certified Regional Poison Center on the model of the Rocky Mountain Poison Center, and I have an MPH from Harvard.
Thank you. Tori?
Yeah, hi, this is Tori. I'm the mayor of Aspen, and I am our voting member on the Public Board of Health for the city of Aspen.
Thank you very much. Brent?
Yeah, hi, I'm Brent Miller. I'm a resident of Aspen. I like to think of myself as sort of the general all-purpose representative. I spent 38 years as an airline captain instructor, and oddly enough, I was a credentialed aircraft accident investigator, and it seems like this COVID is just one huge accident. So that's kind of where my skills lie.
Christina?
Hi, I'm Christina King, licensed clinical professional. I'm the founder of Aspen Strong, a local mental health counselor, and on the Board of Health.
Okay, let's now introduce, I think I got everybody, all the alternates. Can you just unmute yourself and introduce yourself as well?
Marky, this is Jeannie. Hi, I'm actually a voting member, so I think you missed me.
I guess I did. I'm so sorry.
No worries. I'm Jeannie Seibold. I'm a pediatric anesthesiologist and pain doctor, and I'm currently serving also on the board of the Aspen Education Foundation.
Hi, I'm Ann Mullins, a member of Aspen City Council, and I've been on the Board of Health for the past 6 years.
Bill, I see you.
Bill Madsen, Snowmass Village Town Council. I am Marquis' alternate.
Thank you very much. Do I see Patty Clapper anywhere?
Yeah, I'm right here. I'm the one hosting the meeting by myself in the room. Yeah, my name is Patty Clapper. I'm a 5th-term member of the Board of County Commissioners representing District 1, and I've held a registered nursing license in the state of Colorado for 40 years.
Thank you very much. As we look at our agenda today, for the public, I'm just going to tell you that there was a lot of reading material that all of us that serve on the board have spent a lot of time reading, which helps advise us as we began to make some very difficult decisions. Some of the items that we'll be discussing today will be updates from Karen. A lot of work has been done by Suzuho, and the decisions we'll make today is the beginning of perhaps easing some of these orders. But we need to do this very cautiously, as I said previously. Topics will include the construction industry, bike shops, landscaping, waiting for pickup at restaurants and the outdoor seating, golf courses, cleaning services, property management, and visitors, lodging and rentals past 30 days. And to that end, I'm going to go ahead and call the meeting fully to order. And we do have minutes from our emergency meeting, and I will entertain a motion for those approval. That was Monday of this week. Do I have a motion for approval? Thank you. Do I have a second? Tom, I think you did the second. Okay, thank you. And now let's move into the director's report. And Karen, I'm going to turn over to you.
All right. Good afternoon, everyone. I'm just going to do a quick sound check again. Marquis, can you hear me okay?
Yes, I can hear you.
Great. All right. Well, good afternoon to the Board of Health members, as well as the, I guess, watching and listening audience out there in Pitkin County. We really appreciate people taking the time to learn more about what's happening with the public health order in particular, which is our primary focus today. But I am going to start with a presentation on overarching strategy of what we're looking at as far as strategy in relation to the public health order and strategy in general, just in relation to COVID-19 and our response in Pitkin County to the spread of COVID-19. I will do a strategy presentation. The board will, I'll walk the board through some decision making on the public health order. And then after that, we will have a epidemiological presentation from our contracted epidemiologist, Charlie Sperger. In the middle of this, I'm also having Dr. Levin, our medical officer, talk about the medical perspective around the public health order, as well as Sheriff Joe DeSalvo talking about a law enforcement perspective on the public health order. So there'll be a little bit of a switch off in the middle, and then we'll go back to the board actually discussing and making some decisions on the current public health order. So Suzuho is going to graciously pull up the presentation, and I'm going to go ahead and get started. So as we're all aware, and this is our board meeting, this is our Board of Health meeting. Hopefully everyone, I see everyone, and no one is sitting in the closet, which is probably a good thing. But we are in a new normal, as we are all aware, and the way we do business is really different. And so this virtual meeting is a really new way of doing business. Certainly televising our Board of Health meeting through Grassroots is a new way of doing business. And so we're all, spending some effort adjusting to this new way of doing business, a new way of really being in our communities and living in our communities. And I'll talk more about that as I go through the presentation. So I just want to remind the public and remind the board of really our overarching goals. And there really are 4 goals that I try to keep in mind every day I wake up, and try to align responses to these goals. And the first goal is really to slow the transmission of SARS-CoV-2, which is the virus, through the population. And so we're looking at population spread and looking at how do we slow that spread in the absence of other ways that we might be able to reduce spread, which includes things like a vaccine. And so the flattening the curve analogy has been played out in the media and in other places, but this is really a strategy to help preserve the healthcare system and to, again, slow the spread. It's not, we're not at the point of eliminating the spread, but really slowing the spread of COVID-19 illness through the population. So one of the purposes of slowing that spread is to help protect the integrity of our healthcare system. We really want our healthcare workers and first responders to be there when we need them. And they are one of the highest risk populations to getting COVID-19, and they are certainly on the front lines of this response, and really we need them, and they're such a crucial and important part of our community. And so by slowing the spread, we reduce that spike in cases, and we really allow the healthcare system to surge up and to get to where they need in regard to as we get more cases in the community. And so that's one of the related goals to slowing the spread. Another related goal is that we really want to protect the most vulnerable folks in our community to severe illness. And that definition of vulnerable is morphing through time as we learn more and more about SARS-CoV-2 and COVID-19 illness. Right now, it's continuing to be defined as healthcare workers because they're just at higher risk, exposed to more risk. Also, people who are over 60 years of age. And then what we're starting to see more and more is that people that have co-occurring conditions or other underlying health conditions are certainly more at risk regardless of their age. And I think we'll learn more and more as this, as we spend more time with this virus, other populations that might be more at risk. Some of the data that's coming out that's doing some demographic work is that people of color might be at higher risk just because of other social conditions in which maybe less access to health care or other reasons that might have put them in a more vulnerable state. And so just thinking through, who do we really want to make sure are protected in our community, knowing that a lot of people that might get COVID-19 might just have mild symptoms, but how do we really prevent people from getting severe symptoms or even dying from this disease? And the fourth goal is really this longer term goal of how do we mitigate the impacts to social and economic disruption. We know that things like the public health order certainly impact society at a number of different levels, at the individual level, family level, community level, and those impacts are severe, and they can, poverty can kill people just as much as COVID-19 can. And so I think just recognizing that we understand those risks, and we understand that the mitigation needs to happen in our community. And I think this community has really done a lot already in response to very generous donations. The cities and towns and the county have put a lot of money into economic recovery and supporting families in this critical time. And so the mitigation's happening, and we recognize that that's one of the goals as well in this response. So with that, thinking about this four overarching goals, we've seen sort of some strategies that have happened within the country, within the state, and certainly within our own community. And this was an article that was put out. Dr. Levin actually shared it with me, and I'm kind of modifying their analogy a little bit. So if you read the article, this might not completely match with what they're saying, but this graph really shows, what happens with the black line if you do nothing, what happens if you do minor mitigation, And then what happens when you do like a really strong kind of suppression tool, like the public health order? And the public health order is a population level health strategy. So it impacts every single person in the population. And that's a really strong suppression tool, right? Because you're impacting everyone at the same time. And you're saying, oh gosh, you know, everybody has a stay-at-home order. It doesn't matter who you are. And so that's really, unless you're an essential worker, I guess. But overall, you know, it really does impact everyone almost equally. It's a heavy-handed response. And it's a heavy-handed response because if you see that red line, that's what happens if you don't do a heavy-handed response in absence of other strategies like antiviral or a vaccine or other strategies I'll talk about in a second. So, you know, you saw these sort of social distancing and stay-at-home orders come down pretty strongly. And the reason for that was that it hits all community, all the population at the same time, and it can really reduce the epidemiological curve so that you're protecting, again, going back to the goals. So really trying to impact those goals. And that's the hammer. The dance is really a different strategy, and it looks at what happens when you start to suppress at a population level. You should see cases go down. You should see that the hospital system is able to function at its normal capacity. They don't need a surge, and that you really are starting to push and suppress down the active transmission of the disease through the community. So what happens when you start to lift that hammer or that suppression tool? You have to have other tools in place to do the same thing, to reach those same goals. And so when we look at the dance, that's really an individual level mitigation tool. And our best tool in public health is, I refer to it just as test, isolate, and trace. So you test people for the virus. Once you find out that someone is positive for the virus, you isolate them. So that's when you get an isolation order on an individual level. With the public health order, it's really kind of a quarantine on the whole population. So then you're doing this just on an individual level. They get an isolation order, and then you trace contact, who they interacted with, to see who else might have had high exposure to COVID-19, and if they test positive or they have symptoms, then you would go ahead and you would isolate them as well, and you would start to quarantine folks that are associated with people that are isolated. That's an individual strategy. It's a tool that we have in our toolbox, and it's the strategy that we have to build time to be able to do once we start to lift that hammer up. So our first hammer really came down on March 13th, which was our first public health order. It was one of the first public health orders in the state of Colorado. We did it in conjunction with Garfield and Eagle County, and it was pretty restrictive at the time nationally. I'll show you some data that shows how effective that was. We continued to refine that public health order on the 18th to restrict groups and events to less than 10 people at that time. And then we did our first stay-at-home order on the 23rd and our final stay-at-home order on the 3rd. You can see on the 3rd, that's the order that we're currently functioning under. The stay-at-home order was extended until the 30th. We did include incomers that needed to quarantine for 14 days, and we also limited group size to 5 people. So the impact of that public health order, the first public health order, you can remember that it was March 13th. You can see the graph at the bottom. This is data from Unicast, which collects cell phone level data to try to figure out what social distancing is happening. If you get an A on their graph, it means that you have 70% or more of social distancing happening in your community. So they had baseline data that they looked at before, and then they looked at sort of this, you can see the chart at the bottom that shows that right when we passed the first public health order, there was a drastic decline in people moving around in our community. Pitkin County has continuously gotten a A rating. I think we fluctuated between a high A and an A minus. And we've been one of the top counties of, I think, 3,000 counties that they're collecting this data around. Pitkin County has actually been #1. several times, which shows that, to me, this community has taken the stay-at-home order very seriously, the social distancing aspects of this in a really amazing way. And I think that I just want to say, again, kudos to this community for really, really doing the right thing and saving people's lives, because you've done this. And so this is really, I think, pretty, you know, it's a limited data point, but it is pretty interesting data to think about, and to think about where this community has and how this community has responded. And so thank you all for that. I mentioned the test, isolate, and trace strategy. So once we start to lift a public health order, we have to have this strategy in place, because it's our other tool in our toolbox to really manage the spread of SARS-CoV-2 throughout the community. So just to kind of, this is a really simple graphic, but it goes through, you know, what does it look like to test widely? And this would be a PCR test that would be testing specifically for the virus in the body at the point in time when the test was administered. It is an isolate strategy. So once someone is tested and they test positive, they need to stay isolated. And then it's also to find all the people who that person associated with, to ensure that we know who had contact with the person that has COVID-19 illness, and then that they would also be quarantined as well. So this strategy is a strategy that right now you've seen there's a lot of limitations with testing, like the actual testing kits and the medium for the testing and the swabs for the testing, and that's been a supply chain issue and also a development issue on a national level, I would say. But this kind of test, isolate, and trace strategy is also crucial. It has to go along with the testing strategy. The testing strategy is not effective in a public health or epidemiological sense without the ability to do trace contacting. That is also a place where we have to build capacity locally as well as in the state. And one really interesting thing is that the data is showing that in order to do effective trace contacting in the United States right now, that you have to have one full-time person to do contact investigation for every 1,000 people in your community. So that means we would need, theoretically, if this data is accurate, we need 18 people to do all of this case contacting work for our community right now to really have it be the most effective strategy possible. So where we are in the end game, Charlie is going to talk more about this in the epidemiological presentation, so I'm not going to go through too much of this. And Kim's going to talk about some of the hospital data that they're seeing in relation to this as well. But we know that when we start to lift and ease restrictions, that we need to have certain things in place. And right now, Charlie's data that he's been collecting does show that we have a R0 value, which is a transmission rate value, that's stabilized and could be less than 1, which is a good thing. It really means that we tamp down the spread of COVID-19 in this community due to social distancing and the stay-at-home order. We need to see that suppression level stay consistent for a certain amount of time. And again, we're buying time to allow the hospital to have the things in place that they've been doing to be able to surge. We've been buying time to get all the PPE in place that we need for a surge as well as for a robust testing strategy. And we've also been buying time to build that case contacting or case tracing team. So that's what we've been doing for the last few weeks. That's what the hospital's been doing, is really allowing us time to get all of these things in place. For when we lift the suppression strategy, we'll have those things in place to actually be able to deal with the spread of the transmission of the virus. We know ultimately the long game around this is that we really want to see that the susceptible population is reduced below the level required for the virus to continue propagating. So that's that R0 value. And we also want to see that antivirals are in place to treat people, and that a vaccine would be in place so that people could you could prevent the spread of this disease. So we know just intuitively in data that our high risk in Pitkin County, really the largest risk we have are visitors. We know that we are a destination tourism location, and that we know that the way that that COVID-19 has spread most rapidly is through travel. Even when we see countries that have had containment and have really good containment strategies, once they open up their borders to travel, they start to see those cases rise. So when we think about risk in our community, I want you to frame up, you know, what is our highest risk and sort of that in regards to the public health order as we start to talk through that. So there's a lot of words on a page, but I want all of you to understand what are the things that need to be in place, the criteria that need to be in place to ease suppression strategies, so to lift that public health order. We have three buckets here: the epidemiological components, the healthcare components, and the public health components. I will probably not go through all of these, but I'll just highlight a couple. So from an epidemiological standpoint, we need to see a stable or decrease in the cases, or in the context of increased testing for at least 14 days. We really want to know that there's a decrease in healthcare worker infections such that they're rare, and that we would see a decrease and or stable cases in adjacent counties. That includes pretty much Garfield and Eagle and in Colorado. So those are just some of the indicators we're going to be looking for. In healthcare, we want to make sure that the healthcare system has the ability to handle the surge level in patients in the ICU, that they have ability to have PPE for all their healthcare workers, even if we had a surge. So that's just a couple of different indicators there. And then for public health, this is that sort of case contact tracing that I mentioned. So we need to make sure that we have the ability to do all that contact tracing and testing, that we can isolate and quarantine folks if they test positive, and that, you know, simple low-hanging fruit, businesses have hand sanitizer at the entry of buildings. And we can continue the physical distancing recommendations, because I think those are going to be with us for a long haul of like the 6-foot distancing, as well as hand hygiene. We're probably not going to ever get away from that for a while. So once those criteria are met, that's when we can talk about starting to ease the restrictions around the public health order. And it's going to be, the recommendations are to do a gradual approach to this. It's not an on or off switch. And in fact, that's really hard for our community to kind of manage. And it's certainly not good for us to manage the spread of the virus, because as you could imagine, once we start to lift the public health order, we're going to start to see an uptick in the number of positive cases in our community, and we're going to see more symptom spread because people are just going to be interacting more together. And so as we start to have people interact and we start to see more and more people getting COVID-19, we need to have an ability to sort of analyze that, understand its impact to the healthcare system, understand its impact to the public health system, and to be able to sort of meter it appropriately with the data that comes in. So every time you do a stage of reopening, you need some distance and time, or some time, I would say, to then hear, okay, or see the data, what's happening at that point, and then to kind of reevaluate. Is it time to do stage 2, or is it time to just hold in stage 1 for a while? And this sort of gradual easing of restrictions is really the best strategy. It's what the state of Colorado is looking at as well. So, so just for an example, stage 1 might be we go from groups of 5 to groups of 10. So we sort of ratcheted down in increments, and so we'll ratchet back up in increments. We could have restaurants maybe are allowed to open, but they have to maintain physical distancing in group sizes. And we could look at a partial opening of retail with physical distancing. So just so you understand that there's an increment to this, and there's strong recommendations coming out from some guidance between the AEI guidelines that I attached in your packet, as well as the Resolve to Save Lives, which is Dr. Thomas Friedman's group, global public health group, and he was the former director of the CDC, and is coming out with a lot of really great guidance right now. So this is all the things that could possibly happen if case numbers and hospitalizations remain manageable within the healthcare system. So with that, I want, again, this is all to help you frame up the dialogue we're going to have with the with the discussion around the public health order in a minute. But Suzu's going to bring the presentation back up. Sorry. Yeah, the presentation. Yeah. Anyway, so with that, I have some recommendations for you that I think might help you to think about some systemic things we can do, like long term, that might make these restrictions and ease the restrictions a little bit easier. And the first is that some of the things you're going to be discussing today, like construction, the construction community has put together some site safety plans in conjunction with building departments and some guidance from, I think, CSU. And what I'm recommending is that industries like construction or landscaping come up with their own site safety plans, that they would submit those to public health. We would do a review of them, and then that would allow them to meet all the standards that are required under the public health order, but allow for more activity to happen within construction. And so this, I attached in your packet a construction example, and it wouldn't be like each individual construction company submitting some plan. It would be collectively that they would have a guideline that they would all be following, and we would just review that guideline to make sure that it meets public health standards. So that's one recommendation going forward. And the next one is that we implement a business social distancing protocol checklist, and that every business in Pitkin County would have to have this protocol checklist in place, and that they would, in essence, submit this, and that they would be posting it. And I'll have Suzuho pull it up to see what it looks like. This is a strategy that Eagle County has started to employ. And I think if we get it in place now, this will help us in the future when we start to ease the restrictions with the public health order. So you can just see that there's a number of things that they have to have in place, and that they really have to have this checklist and have to have thought through it and to post this in their business so that everybody knows that they're following these things. So that's just another strategy that we can have in place as we start to, and it's something we could do, we could theoretically start working on tomorrow with businesses. It's not going to hurt to have this, regardless of what you do with the public health order. So, okay, so now I'm ready to turn it over to Dr. Lovin, our county medical officer. Kim's going to talk a little bit about the medical, what's happening from a medical perspective around COVID-19 in relation to the public health order. Then I'm going to have then I'm going to have Sheriff DeSalvo speak a little bit of the law enforcement perspective, and then it'll come back to me, and I'll lead you through a process of talking through the pieces of the public health order that I think have most come to surface in the last few weeks.
Thank you, Karen. Can you hear me okay?
Yeah.
Yeah, thanks. Okay. Yep, I'm Dr. Kimberly Levin. I'm the Pitkin County Medical Officer, and I'm a practicing emergency physician at Aspen Valley Hospital and at Valley View Hospital. And I'm going to support everything that Karen just said. First of all, I want to, as the voice from the medical community and from the hospital, I want to thank everybody in this community who has done such an amazing job at managing your symptoms at home, at stopping to spread the disease. And it has literally been an outpouring of gifts to the hospital and support of our medical workers. So I want to thank everybody, big clap, and really from the bottom of our hearts. And Dr. Dave and the CEO, Dave Ressler, has really mentioned this every morning in the incident command meetings, and we want to thank you. So let me see. So I am here to tell you that this disease is here. There are a lot of people who think that this, they look around and it's really hard to see that this is actually present. And I want to remind you that 80% of people have mild symptoms. And so you may see, your friends and family having mild symptoms. And what about the 20% of people who are having severe symptoms from this. And so the medical community is really challenged right now. There are different theories going on, and excuse me, 1 second. These original risk factors that we thought were going on, which are still happening, and these risk factors are increased age, immunosuppression, diabetes, heart disease, and kidney disease. And these are what are killing people. However, what we're seeing in the medical community is this is not the full picture at this point. These were out of China, and it's still true. But what we're seeing is that there are younger people without risk factors who are also dying from this. And in the U.S., the ICU care of people in their 40s and 50s are about 10 to 11%, which I think is very high. And again, as age goes up, this goes up. And we do know that as you get into your 70s and 80s, it's up to 30%. Now, in Colorado, we're also seeing this, and it's very concerning. So people in their 40s and 50s, up to 20% are hospitalized, and that's a 1.2% death rate, which I find very concerning. Again, as age goes up and comorbidities go up, which are the immunosuppression, people with cancer on immunosuppressive drugs, heart disease, chronic lung disease, these deaths and hospitalizations rise dramatically. So 33% hospitalization rate and a much higher death rate. So this picture is a little different than what we originally thought. And the medical community is extremely challenged by this. And every day I can tell you there are conversations from coast to coast with some of the best minds in medicine, from ER doctors, ICU doctors, all type of physicians that are trying to figure out what exactly is killing, especially some of these young and healthy people. And there's a lot of different theories going on. There's theories of clotting disorders. There's even some theories that this may look a little bit similar to high altitude pulmonary edema. Very complex medical picture going on, but we're working very hard, and everyone is trying very hard to figure out how do you save people from dying from this. And unfortunately, it is affecting younger people, and that fact in itself is making this a trickier disease where there may be there are people who are healthy who are getting it, and maybe they are asymptomatic, and we know that there are people who are asymptomatic who are actually transmitting the disease. So it's a little bit of a more complex picture, but we're working very hard. And I also want to mention the Aspen Valley Hospital medical staff letter that was put out supporting the public health order on March 24th. And the hospital is very much behind and working very closely with public health. So the next slide. I think we've done this, and I know this is a little repeat from what Karen had said, but I feel that we have stayed, and the goal here is to stay within the healthcare system capacity. And so I think we have flattened the curve in Pitkin County, and again, we want to thank everybody for doing that. The red line is a surge, and what the hospital's been doing, and the efforts have been tireless, and everyone has been working nonstop about creating a surge capacity. So what happens if we're not able to flatten it below the healthcare system capacity? What do we do then? And there have been extremely innovative solutions. There has been a tri-county collaboration. There has been a lot of work that people have done working together and in the different hospitals in the county and working as a group to see how many ICU beds do we have. And this is in case and for the possibility that the Denver ICUs may be closed, and we may need to take care of everybody up here. So we need to plan for all this, and you all have given us time to do that and put these in place, and the hospital is very thankful for that. And so the next slide, that is not, oh, okay, it looks a little different. Anyway, I'll work with it. This is an opportunity to give you data from Aspen Valley Hospital, and I know it actually looks a little differently. So on the upward axis, it's the number of patients seen, and on the lower axis is March 1st to April 15th. And it may be a little hard to see, but this is the data. These are the number of patients that Aspen Valley Hospital has seen on a daily basis over the past 6 weeks, which is great data. There's the little bump, which looked more prominent on the graph I had, but on March 13th was our highest number of 8 patients at once in Aspen. And that is the day that the first public health order went into effect. And so in that next week, there were the subsequential, very increasingly restrictive public health orders that literally within a week, I think had a significant effect on our hospital data. And if you look over the past 2 weeks, we've stayed in very low volumes, manageable volumes. We are still seeing patients. It is still here, but we are able to manage it, and it has been fairly steady over the past 2 weeks. And so again, we want to thank everyone for creating that situation and allowing us to be able to be there and safely take care of the patients that are that we are seeing. Okay, another data slide, which I thought was really interesting. This is from the Symptom Tracker, and the Symptom Tracker is on the Pitkin County Public Health website, which hopefully everyone knows about. The Symptom Tracker is you can go in and put yourself in as a case, what your symptoms are, what the dates are, and this is an excellent tool for epidemiology, I think, in terms of just looking at the community and seeing what kind of symptoms are there and seeing when the peaks are. One thing about this is that we think the data is very limited, unfortunately, and we are urging everybody to put in their symptoms in there. If you have had any symptoms since March 1st, please enter them in. And if you have any new symptoms, if you're someone who has new symptoms, please go to that website and enter them in. It's really going to help us out to be able to figure out, especially moving forward, if we start getting bumps in the community in response to some of the lifting of restrictions that we start doing. So again, the height of what we're seeing in the symptom tracker in this composite data is around March, the middle of March 13th, and I think it really well correlates with these public health orders and shows that that it's really working. Just as note, the number one and number two symptoms reported by people in Pitkin County are fatigue and cough. However, as we all know, there's a lot of this is presenting in a lot of different ways. People can have shortness of breath, some chest tightness, headache, diarrhea, nausea, a variety of symptoms, and then the loss of taste and smell, which is kind of unique to this virus. Okay, the next one, this reflects a lot of what Karen was saying. And so this theory of the hammer and dance, I think, is really, really important here. And I do think that this is going to be, at this point, a good model for looking forward. So we are at this point where we have done, and this is just, this is more of, I showed this one just to look at the graph itself. This is something taken out of context, but it looks at ICU cases. But again, it's a way to use hospital data to be able to feed back and tell us, are we doing a good job? And are we able to open up things in very small incremental doses, basically? So after the big surge, the goal going ahead is that as we're going to hopefully look at today, as you lift one little restriction at a time, because if you open everything up, it's going to surge way above hospital capacity, way above that line. So we need to do it in incremental doses so that we stay below hospital capacity and we're able to treat people safely. And that's the goal. And so the other goal is that we need to move ahead and do this. We can't stay where we are. It's a situation for everybody that we cannot sustain this situation. So we know that we need to move ahead. So in these really small doses, what I wanted to explain is my thoughts of how we move forward when you open something up and say you do it in a small way. There is sometimes about a 2-week lag that they've seen between lifting a restriction and what type of surge that might create in a community. And so how do we know whether what we do is going to create a surge, and how high is that surge going to be? I think hospital data is going to be very important in looking at the number of people seen in the hospital, the number of hospitalizations, the number of ICU patients and people that we transfer to Denver, as feedback back to the public health and say, listen, this one is manageable or this one is getting too high. We have to actually revisit this, what we just opened, and do a feedback loop. And I also think if people can really enter data into the symptom tracker and get that to be a really valid way of looking at things, that we'll be able to see what kind of effect it has in the community as we do these little increases. And as it surges, we just don't want it to surge too high. but we need to make it go forward. So we'll be marching towards an end goal. There is an end goal, and that is to open everything up. And I know that this is going to happen, and we can make it happen. It has to be very careful. We have to do it in very small, kind of incremental easing in a very, very controlled manner so that we don't overwhelm the healthcare system, but that we continually to move forward. And the end goal here, and I'm guessing epidemiology will really look and talk about this a lot more, is herd immunity. And that is going to come. And there's two ways to do that. How do you get a certain percentage of the population immune? And that is from people who get the disease, and you create antibodies. And secondly, it's from a vaccine. And so we kind of have to keep going along like that until a vaccine is developed. And that is the goal. So my recommendations today to the board, as we look at this, is that yes, we do need to move forward. And yes, please do it in an incremental way. And we'll be in very close contact with the hospital and hospital data, and in terms of a feedback mechanism for doing this correctly and safely for everybody. Thank you.
Joey, you're up if you're there on your iPad.
I'm here. Good afternoon, everybody. Good to see everybody in good health. I'm going to give you the basic law enforcement breakdown of things that have occurred or not occurred in the last week or so in Pitkin County. Probably one of the biggest changes that you're all aware of is that we are still under a stage 1 fire restriction. That is extended to all agricultural burns. Any existing permits have been canceled. Right now, it is Garfield, Eagle, Pitkin, U.S. Forest Service, and BLM lands are all affected by that. So there is no burning, and as we all know, that is to protect our resource firefighters. We don't want 15 or 25 firefighters on a scene. That is unnecessary because some of these agricultural burns got out of hand. We've already had one in Shieldo Mesa last week. That was actually started by a transformer. Luckily, it was put out in a short period of time by Roaring Fork Fire. I'll move on from that to Title 25 violations, which is the violation to the specific public health order. We had another violation the night before last. It was issued a summons. As we said, it's a first-degree misdemeanor. The punishment is pretty severe. So we have one of those, and I can give detail if anybody wants. But we are still sticking with a near zero tolerance on violations of the public health order. People in our communities are generally compliant, but my officers and officers from all jurisdictions are reporting some basic restlessness. And that restlessness usually manifests in the form of people that I happen to think are very compliant who see people who are not compliant, and I think express their displeasure by calling us with those violations. Some are minor, some are egregious, but we are starting to get more calls from citizens about violators, whether it be they saw a California license plate in somebody's driveway with some luggage in it, and there are others, examples like that, that we are doing our best to manage in the most efficient way. The jail population is low, and it's always a concern that that may spike because that could be a problem, or if we have an infection within the jail, which I'm happy to say we haven't yet. The reason why our jail population at this point is so low is that our judges and district attorneys have, I think, come up with some creative ways to keep populations down. That is anything from PR bonds, which are personal recognizance bonds, to felony summonses, which are new to us, but we're happy to do them on people that are nonviolent and not a threat to the community. For the most part, that is my update, unless there's any questions, or Karen, will we just do questions later on? Okay, anybody have any questions?
Well, I was gonna, yes, so I was gonna pause here before we dive into the public health order discussion and see if you have any questions for myself, Dr. Levin or Sheriff DeSalvo. Oh, sorry, I'll let Marky facilitate, sorry.
Okay, Tori, I saw your hand go up.
Thank you. Thank you very much, and thanks to everybody being on this call, and hope everybody's doing well today. Hopefully this snow is going to help us out with a little bit of the social distancing and separation, but I know a couple people are getting out there on the hill. My question is for Dr. Levin. You showed some statistics about numbers of cases and numbers of deaths, and I just wanted you to maybe just speak for a moment about what those numbers really tell us in the absence of widespread testing. Are there assumptions that you make there? Is there more to those? Is there more information to get from those numbers? Yeah, exactly. Current numbers up there at the top. And I'm just, I'm looking at death rates, and I'm just wondering, 51 cases in PICO, that's tested, confirmed cases. If you just speak to those numbers for a second.
Sure, yeah. Thanks, Tori, for bringing that up. We have limited testing. There's limited testing throughout the entire United States. Without widespread testing of all 18,000 members in our community, we will not have the most accurate rates and numbers. And that is correct. And that is unfortunately what's happened here. And in a perfect world with the most resources and testing for everybody, and I want to add a good test. The test that the antibody test is, there are limitations to it, and we're discovering a little more day to day how this test is going to best be used, and it really will mostly be used for an epidemiological reason. It will most likely not be used clinically, but you are absolutely right. These death rates are probably not totally accurate, given that there are most likely more cases than tested. So in Colorado, 8,280 cases as CDPHE has reported, and in PICO, we know here this is way more widespread than that. And that's why we tried to use the symptom tracker and look at some of AVH data to actually look at trends rather than absolute numbers, because we don't have the ability to do that. Now, the county does have 1,000 tests, and we're beginning this whole process to try to get as accurate testing as we can going forward. And it's going to be a process. And again, the test itself is not, it has a lot of limitations to it. You've probably seen in the newspaper sensitivity and specificity discussions and false negatives and false positives. And so testing itself is not going to be a true perfect science, unfortunately. And so we have to just look at the numbers that we have and make the best estimates and go forward with the tests that we can get to get the best information that we can. And I know that IMT has been strategizing on how to use these tests in terms of epidemiology, not in terms of clinical reasons. So I agree. And I think, some more numbers worldwide. There's 2 million. In the U.S., there's 630,000. And the death rates that I'm calculating from this are about 4%, 4.3%. But again, it may be lower if we had better testing. And that is a great point.
And then if I can just follow up real quickly, and Marky, I'll let you determine if this is an appropriate question for right now or not. I was wondering, there's a lot of questions that are coming in about the 1,000 tests that have arrived in our community, and who is going to be able to be part of that 1,000 testing. And I understand that really we're still kind of working that out, but I have a lot of people that are getting in contact with me that are very much hopeful to be getting tested, and I try to explain that this is 1,000 tests spread over an 18,000 person population, the entirety of the county. Is there any message that we can be doing right now about that 1,000 tests? And as I wrote my question here for my own notes, I wrote, who should not get their hopes up? I think a lot of people are very hopeful that they're going to be able to be tested, and 1,000 tests is just not going to cover. So I don't know if that's appropriate now or not.
Karen, could you that question because I know that's first and foremost on many people's minds. I think I had phone calls this morning.
Yeah, so I'll do a quick analysis of that, but I also want to make sure that we have time to talk through the public health order conversation. So we have a committee. Dr. Levin is leading a medical advisory team. We have a logistics team as well as an epidemiological team that has been put together to talk about the testing strategy overall. And the epidemiological team, as Kim alluded to, is really looking at, from an epidemiological purpose, who should be tested. And they're putting that criterion together, and then they will be unrolling some sort of form that will be on our website where people can go ahead and fill out that form, and we will notify people if they are want to fit in within one of the criteria and will be selected for this antibody serology testing. And so, Tori, to your point, it's 1,000 tests, and we're using this for epidemiological purposes, and so we need to make sure that we have the proper criteria and analysis of how best to get that epidemiological data, and that will really be who then is in essence eligible to do tests at this point. And I want to, without getting into too much detail, Dr. Levin mentioned the serology component, the antibody component to these tests. We will still, when I talked about that test, trace, and isolate strategy that we're trying to build capacity for, that's using the PCR testing so that, the test that tests specifically, do you have the virus in your body? And it's not an antibody test. So I'm hoping that next week we can actually do a community meeting that focuses more directly into testing. But right now, that's what we have to share.
Thank you very much.
Did we want to hear from Suzuho and Charlie next, Karen?
Right now, I'd like to lead you all through the public health order and some decision making on that, and then we'll turn it over to Charlie to do the EPI portion of this, because I think I want to make sure we have time to get through dialogue around the public health order. And so Suzuho is going to bring up this first.
I do have questions. I'll save them for later, but I do have questions.
Okay, well, thank you, Greg. Let's move on. Karen?
What we've been doing is we've been culminating all of the places where we're hearing from the community around specific clarifications that they've wanted around the public health order. We, as you all know, we did a comparison of the state public health order and our local public health order the last time we met, I believe. And what I wanted to propose and sort of walk you all through is where we are still differing from the state health order in relation to some of the community comments and questions we have gotten. So we took really kind of these big bucket themes that we had been hearing from the community and that you all had been hearing from the community, and we looked at where they aligned or didn't align with the state order. And so you can see here on the left side, there is our language around the health order. On the right side is the state order. And then in blue is staff recommendations. So this is public health staff recommendations to the Board of Health on some of these components. And you'll see as I walk them through with you that some of them we recommend an easing of restrictions, and some of them we recommend maintaining. And so I just want to go through them actually step by step with you all. And Marky, I don't know if it's better if we, if I talk about the where we are for each row, or if you want me to go through all of them and then go back. Is it better to just do the one by one?
Yeah, I think we ought to just do one by one, because needless to say that there was a lot of reading material that we all had, and I think it's best that we stay very focused on this conversation and take one at a time. So Karen, you want to lead us here?
Sure. Yeah, so you can see right now that we, when we went ahead and restricted sort of I call this kind of grouping or congregate groups. We said all events of more than 5 people, not of the same household, are prohibited. So that means, like, if you were going out and you were going to go skin up, tie, hack, that you would be in a group of 5, less than 5, and that you would still be maintaining all those social distancing kind of requirements. Interestingly, the state said that all public and private gatherings of any number occurring outside of a residence were prohibited. And the reason why we decided to make this a little bit looser was that we recognize that a lot of people in Pitkin County might be a single person that's moved here, and they may not have family to interact with, and that going out, skinning up the mountain with a friend, as long as they were maintaining all of the good social distancing, is a really strong thing for them to do socially and helps with people's social and mental health. And so we didn't actually go as restrictive as the state order did. And I would still recommend, or public health staff still recommends, that we would keep our current group size at 5.
Do you need us to comment on that?
Yeah, just a second. I can't figure out how to see you guys now all of a sudden. But there we go. Thank you very much. So, any comments on size of groups? I will make just a few comments here, and it's more of an observation. This morning, I sat through a marketing and tourism talk here in Snowmass Village, and we're looking at, obviously they're looking at what the summer season might look like. There's a great deal of eagerness to start taking the group size up. I think we need, from my perspective, I believe that we need to keep it where it is, and perhaps 2 weeks from now or 3 weeks from now, we take another look at that. But to start lifting the size of groups, I think, is too premature. So I agree with the staff on that one. Any other comments?
Marky, can I make a quick comment?
I think we should reevaluate that at the end of this month.
I think the hospital has concerns, and this may put some information into here, that there may be potentially surges this summer. So to set us up for a successful summer in terms of not having surges and overwhelming and having things open up too much in terms of the group of gatherings would be a great way to try to prevent that type of surge this summer. Yeah.
So what I'm hearing is consensus, but could I have hands up of voting board members if you agree with the Tom?
Is that implementing now?
That's currently what we have now, no more than a group of 5.
I add to that, can we reevaluate that at the end of this month?
Well, we'll be evaluating everything because the public health order goes through April 30th.
I'm in approval.
Okay. Okay, moving on, Karen. I've got a big gold retriever trying to bug me.
I just saw that. That's awesome. Suzuna's going to pull up the slideshow again. Hold on just for a second. All right, so the next one is probably the hot topic here. It's around construction. As you know, we restricted more construction than the state order did. We really only allowed for essential infrastructure and public works. We restricted residential and commercial construction. At the time, we recognized the large impact of the construction industry within Pitkin County, and that's coming from other communities to work in construction, truck loads of people carpooling together and recognizing that work sites might have a lot of people that are on the site and also in small spaces, maybe working together on construction projects. You need, people might need to be closer together because of certain aspects of construction. With that, we have gotten a lot of really amazing coordination with the construction industry. They have put together, in essence, a site safety plan. I attached a couple different versions in your packet, but also I know our building departments, community development departments, both in the city and the county, have been working really closely with construction to actually create even a more robust site safety plan. That hasn't been approved yet, but we got a glimpse of it last night. And so what I see happening is that the construction industry is really trying to mitigate for some of the things that I think when we originally put them under, they've been able to mitigate or discuss how they would go ahead and mitigate for those concerns. And so right now, because of that, staff would recommend that as long as the construction industry has a site safety plan in place and that they're continually adhering to the social distancing requirements, that they would be allowed to match. We would go ahead and match the state order, which allows for all construction, and that they would, in essence, there would be some really strict kind of requirements if they didn't meet the site safety plan or started to deviate from that, that we would have a system in place in which they would not be able to operate. So it allows for a little bit more freedom in that bucket of construction. We also decided that landscaping really could fall under the same kind of criteria. A lot of the work is, they're outside. A lot of concerns we had with construction we had with landscaping, but if they could also have a site safety plan that they would be following, that they would follow and be allowed under the same requirements as construction. So as you can see, again, there's the blue of staff recommendations on that.
Okay.
Marky? I have a question.
It's Ann.
Hold on. Okay. Now I can see you all. Who was that, Ann?
Yeah.
Ann, go ahead.
So a couple questions. For both the landscaping and the construction, is this all types of projects or just different types that'll be rolled out one at a time? And the other question, I have seen the construction safety protocols, and they're really very, very good. They're very comprehensive, very thoughtful. They certainly build a case for opening these sites, so they will be able to open safely. But I haven't seen one for the landscape industry. So the two questions: all types of construction and landscape, and does the landscape industry have a safety protocol written out?
Erin?
Yeah, I could try to answer part of that. So I would say, Ann, that when we had talked about landscaping originally, it felt like seemed like maintenance and kind of continual upkeep makes a lot of sense. Like the retail component, we really haven't opened up retail, and so that doesn't, if it's a nursery and they're doing maintenance and they're also trying to sell marigolds, just more the maintenance component of this. It's not the retail component of it. And then we haven't seen a full mitigation plan from the landscaping industry. I know that we've gotten some snips and bits, from them. That would be the recommendation. Just like with the construction industry, they came together and worked collaboratively with ComDev departments to put together that plan. I would want to see the thing come collectively from the landscaping industry. We don't want one-off plans. We want a collective plan that we can say, yep, this looks great, and now you're okay.
Okay, and I am supportive of this, but I'm anxious to hear other board members' comments.
Brent?
Yeah, just one. Given.
When you're not talking, let's mute.
Oh, thought I had, can you hear me now? You can hear me, correct? Yeah. What about giving some thought to easing any restrictions during the summer? I mean, that was sort of a traditional luxury, but given the economic blow to not only the city, but to the construction people, what about easing some of those restrictions?
Marky, this is John Peacock. Can I weigh in on that?
Absolutely, go for it.
So, Brent, that would be a consideration of the municipalities and the county under land use. So it could be a recommendation, but it couldn't be directed by the Board of Health.
Understood.
Okay, Tori, I see you've got your hand up.
Yeah, I just wanted to go ahead and respond to Brent that we have scheduled we are scheduling a work session for that topic exactly in the city of Aspen.
Okay, Greg?
Yeah, hi. I think I saw in the packet a letter from landscapers that included several signatures at least. It was like the construction letter that we saw that had criteria for landscapers. I'm sorry, somebody else talking. Okay, and the thing I wanted to say is I heard just on the radio an interview this morning with one of the Garfield County commissioners who expressed the real hope that Pitkin County would ease its restrictions soon. And it made me think, on our Pitkin County, our slide you put up about easing suppression strategies, the very bottom one on epidemiology, a part of our decision will be based on decreasing and or stable cases in adjacent counties and in Colorado. So I want to make sure that we're paying attention to what other counties around us are doing. If they're not taking it as seriously, all our efforts could be for naught. If they're taking it seriously, that's good and we support them. But I want to make sure we understand the nexus between what the other counties are doing, especially when we're talking about relaxing restrictions, which means more people will be coming from these other counties. And I really appreciate what I saw in the construction guidelines that were put out, and I want to make sure that carpooling restrictions are articulated so clearly that we don't have a problem with multiple construction workers pooling together, in a van to come up and then separate when they get here.
I had a question relative to the whole construction plan, which I agree with everything said. It was well written, and I applaud everyone in that industry who worked so diligently and so hard to really put together a good plan. The question is, how are we going to monitor those sites, A, and I guess that's probably Joe's department or the building officers, or when might we put this into effect? Don't they have to have some training, or are we just going to turn them loose? Karen?
Yeah, I wanted to just talk a little bit about putting into effect, and then what I do know, and I might have John Peacock jump in on this a little bit, because I know that Cindy Hubin has been working closely with the construction industry. But for all of the, I want to level set here that what we're talking about today is the current public health order and short-term adjustments to it. If you decide, let's just say for construction right now, that you want to go ahead and move forward with the staff recommendation, then I would make the recommendation that we give a little bit of time and we don't actually have any of the changes that you're making to the public health order today go in effect until the 23rd. And that gives everyone a little bit of time, right, to ramp up, get those guidelines in place, think through some things. It gives our building department and broader community development department to get some things in line. It allows us to have conversations with the landscaping industry and such and so forth. So I think giving us a little bit of time, so the 23rd would be my recommendation, recognizing that the full public health order is still in effect until the 30th of this month. And that's a whole different conversation. That's the long-term conversation, sort of what Greg was alluding to, of like the criteria that we want to look at for the first suppression list if we're going to go in that direction. So sort of to think of this as a short-term conversation then we have a longer term conversation about the full public health order and lifting of other things or not around that. And in regards to our neighboring communities, we know that Eagle County is looking at lifting or easing some of their restrictions in their community. Their public health order is already looser than ours. We know Garfield has been matching the state order, and I would guess that they're going to follow in line with the state. So whenever the state starts to ease its own suppression strategy, Garfield County will do the same. We're trying to have conversations, or we are having conversations, to best align the three counties because we recognize our interdependency. But I also think that we also are all in a little bit of a different place. So we may not always see a complete alignment between Eagle, Garfield, and Pitkin, but what we are looking at is their data, and we are talking with them, and we're doing a lot of conversations to try to match as best we can.
John,
anything?
Yeah, so Marky, some of this is still in process. I will tell you from the county's perspective, what we are looking at is bringing those safety plans in through actually our community development department. Having training through public health about the key elements that need to be checked off on that safety plan for an approval, and then issuing basically a letter and having that plan posted with that letter on site. We'd then be using our code enforcement function to oversee and check on compliance. We are meeting with community development directors or staff, I shouldn't say directors, staff. I'm not exactly sure who's in the meeting tomorrow. But our community development is reaching out to both Snowmass Village and Aspen to see what the capacity would be for a similar type of process but before it's rolled out. But the experience of our neighbors in Eagle County, they have had a similar kind of process. They were not as restrictive in their public health order as Pitkin County was. In talking to them, there has been good voluntary, basically, compliance. And so we're not trying to have as rigorous a process up front, but make sure that the plan meets the standards that are established by public health. And then we have a check-in for enforcement, much like the rest of our public health elements.
Thank you, John. Is this all feasible to get done basically in a week?
Yes.
It is? Okay. Thank you.
Yeah, we've already been working with representatives from the construction industry. I think a lot of companies are already anticipating needing these safety plans and what adjustments that they would need to make in order to accommodate them. And so, I think that the biggest potential bottleneck is, again, how we're taking these in. And if we can get partnership with our municipalities through their building departments on that would be great. If not, we'll probably need to take those in ourselves. That will obviously create a little bit more of a bottleneck for the industry.
Thank you, John. Ed?
Well, who's ringing?
Don't know.
Is that this phone?
Marky, Patty's had her hand up for a while.
Yeah,
Let me wait. I had to ring the phone to get some attention here, but I don't. Marky, just one sec. I just have two comments. One is that I know that some of the major construction companies were already instituting these guidelines prior to being totally shut down. So I think a lot of them, that's where a lot of the information is coming to us from. And I think for them to gear back up will be much easier, but hopefully they'll help other companies come on board. The second thing is I'm glad we have, Karen, that you mentioned a couple dates here for us to start to gear back up again. The Board of Commissioners will have to discuss reopening the landfill because we're going to have construction waste and landscaping waste that's going to need to go to the landfill. So we're going to have to look at that and what safety precautions we may need to institute at the landfill to keep our staff safe out there for this, returning these issues to coming up to the landfill. And that's a priority for me. But I do support reopening, and I totally support trying to look at things, rolling it out slowly, making sure we're doing the right thing, and making sure everybody understands the goals. So thank you. Thanks, Marky.
Marky?
Ann, go for it.
Yeah, thanks. Sorry. Just to follow up with what Patty just said, she said it perfectly. We need to do this very slowly and very carefully, and that's why my question about are we allowing every construction project to start up again, new ones, ones that have been stopped mid-construction. So I still would like an answer on that. If it's every construction project that will begin again. And then just to John's comment, I know that Aspen City Council and staff is happy to work with you on that rollout. So, but if I could get an answer to the first question, that would be great.
I think the plan is every construction site.
Yeah. So, sorry, I unmuted. It probably is a question more for Karen, but it would be every site that can meet the social distancing standards. And so there will be some projects, frankly, of a scale or just design where critical path steps may be difficult to achieve while meeting the social distancing standards, but as long as they can be demonstrated, basically we're aligning more with the state order, but simply by having the social distancing standards as well as the sanitation facility standards and such, we are stricter than the state still.
Okay, thank you.
I know you had your hand up too. Tori?
Okay, let's see. I'll make a couple of comments here. One, did I hear from John Peacock that prior to returning to a job site, there would be a letter ahead of time that says our intent is to open, here are the protocols that we're putting in place for every job site that wants to go back to work? Are we talking about getting notification and getting those protocols up front? That's question number one. And I guess I'll just wait because that's an easy answer. John, if you're there.
So, yeah, Tori, the expectation would be that a safety plan is submitted and that it's reviewed to ensure it contains the critical elements for social distancing and sanitation. At that point, then, they would be issued a letter saying that they're allowed to restart their project. That way, not all projects start up. We still have to see a plan that is viable before construction is allowed to proceed.
Okay. I have not had this conversation with my city manager or my city council with a 1 week time frame here of the 23rd. So one question that I have is review personnel, not just enforcement, but review personnel that are able to say, hey, this site is working correctly and we do feel confident in them continuing. So I don't know if we have the ability to really oversee this being implemented in the safest manner possible. Another point that I would say is we're picking the date of the 23rd. The 23rd is a Thursday, and it's 1 week away. That just seems like a little bit of a rush when I think we're all interested in getting this sector going again, but perhaps there is a little bit more work to do on the front end of this, that maybe a restart date would be better put on the 27th, the Monday after that weekend, instead of that Thursday. And again, you know, I want to be sure that I'm clear here. I support a slow rollout to get back to business, and in this sector as well as the landscaping, I think is one area, but we do have some more work to do. So I wonder about a 1 week date on that. And the last 2 points that I have for this discussion, Greg Poshman sent a letter that I received today in an email that had some other great ideas and other great protocols, for example, the carpooling and stuff. And I would like us to be able to consider more of that stuff as we're trying to move forward with this. The last thing I have there is I didn't see in any of the materials that I saw, I did not see a symptom or case reporting component. I did see that there was some tracking that was part of the protocols, but I didn't really see anything that mentioned that if somebody did show up to a job site with symptoms, that was then going to be reported, that there would be more investigation into contact tracing within that site and stuff. So that's another thing that I'm wondering about that I did not see in it.
Erin? Let me just address that last piece, and then I'll let other people address the other parts. So anytime someone tests positive with a PCR test in this community, that is a reportable condition to public health. So we get every single positive case that happens in Pitkin County reported to public health. That's a part of the public health system that's been going on probably since public health has been institutionalized. So that's how we get that data.
But clarify that, Karen, if you will, because the PCR testing, I'm talking about somebody that shows up to a job site and isn't feeling well and maybe has a fever reader, a non-contact fever reader. You're saying that case would be reported?
No, sorry, only when someone tests positive. Yeah,
so I'm talking about symptom tracking. I mean, so, if we're going to be allowing this construction to go on, and we are getting an influx of employees from other counties, we need to be tracking this. I mean, this, what we're talking about is the downside here is that this continues the transmission of the disease. So I'm just wondering about those avenues to lessen that. And for me, if somebody's showing up to a job site and they just simply say, hey, you don't feel well, go home, I think there should be more notice around that report.
Yeah, Tori, if I could jump in, the process that we're working on does include both a daily reporting log. We're building a Google spreadsheet so that can be accessed from anywhere for the job sites, as well as locations of workers.
Okay.
Karen, do you, I guess one of the questions that Tori put forth, 1 week from today, all of this could get done? Or are we?
So maybe I'll answer that one.
Yeah, okay.
Again, no doubt, it's a push. It's one that, at least at the county level, we think we could do. I think maybe what the Board of Health could do is to provide a little bit of leeway based on our conversations with our municipal partners. Because to Tori's point, the reason you haven't had those conversations is we're getting this stuff out to your managers this morning to talk about. So please note, Sarah has not been holding anything back. But we're also trying to recognize the significant impact, obviously, that the public health orders have had on other social determinants of health, like employment and housing and those sorts of things. And so we're trying to act nimbly and trying to act quickly to bring those sectors back incrementally as we feel it's the appropriate thing to do based on the data that we have. And so one option for the Board of Health would be to give us some leeway, and for if we're able to coordinate the process in a meaningful way with our municipal partners to let us go earlier, or to maybe let us, to Tori's point, set the date a little bit later if we need some more time to do it right.
Well, I think that all of us, Tori and myself, would be very supportive of the leeway as we're the leaders here within our own communities. But given said that, Tom, I see that you had your hand up. Unmute. Okay.
No, you muted again.
We're gonna
Stop fighting.
No. Okay.
I wish to compliment Karen and Kim for their superb descriptions, but I tend to side with Tori as a sensible beginning of the implementation would be on Monday the 27th. And you could be fully prepared with filling out all of the forms prior to that, but Monday the 27th makes more sense than a Thursday, which is sort of the end of a week.
Thank you.
And so if I could make one more just comment, it may make sense to establish that start date for construction activities, but as we have the process ready to go to push out the directions for the safety plan and to start collecting those as soon as possible.
I think there's a great deal of consensus. Oh, I'm sorry, Kim. Go ahead.
I just wanted to put in my view here that I do agree with giving more time to this. I know that there will be a bump in cases from this. We will clearly see it if we have good tracker information. We are bringing people from outside the county in. However, this is the dance that we're all talking about, and where is that fine line to move between going ahead but doing it very carefully. So I do agree with having some more time so that we have some really great protocols put in place for this. And I would also put a pitch in doing it incrementally, not everything all at once, but maybe having an incremental approach potentially to versus old construction versus new construction, and maybe not opening the doors all at once, just to consider that.
Your thoughts? I see Brent, you've got your hand up.
Well, just real quickly, I don't know whether we want to get into the weeds in this thing, but we talked about people showing up to a job site not feeling well. We talked about in the final phase that we want to ideally check on people coming from questionable destinations. So my question is, do we want to give any thought to at least recommending, like at these job sites, that the temperatures be taken with these little handheld devices? I mean, otherwise we're relying on somebody stating, right, that they don't feel well. And this is
I thought that was in the protocol was temperature taking.
And how widespread, though? We're strictly for the construction sites, or are we going to do it at the airport too, as many airports do on a gross basis, at least internationally? Just a thought.
Aaron?
So I think just to kind of stay in focus, that the mitigation site safety plan that the construction industry has put together does have the temperature taking as part of that business social distancing protocol that I shared with you all. And this is actually already in the public health order, that every essential business open right now needs to have some sort of check around symptoms with their employees, whether that's a temperature taking check or some other methodology that they're using. That actually already is in the public health order. So I would just say that these site safety plans can go into further detail, and that from a public health perspective, we can give recommendations on that. I don't think that we're talking about the airport, so I want to kind of keep that separate. But John,
fair enough. Yeah.
On that, if you want to, we don't have a lot of jurisdiction at the airport.
What I'd advise is right now, I think staff has laid out for the Board of Health a number of short-term adjustments, which represent an incremental change. And Brent, those incremental changes include some of the measures that you're talking about, and then we can evaluate the effectiveness of those as we're talking about the next stage. You guys don't need to decide on all the stages right now. I think the decision point today is on the recommendations for the near-term changes to the public health order, and then getting a sense of what the steps, what the different stages would look like for further unwinding. I think we're going to learn. That if there's one thing that's been true about this event, we're learning every day, every week. And the more we learn from the experiences of other communities or our own community, we'll have better recommendations for when we take on the next stage of unwinding the public health order. So I'd really encourage you all to focus on those near-term ones, because those are probably the ones
I think
that we have direction on.
Thank you, John. I think we've spent a lot of time on the construction. I think Karen and her staff, has all of a sudden, oh, there you go. The point is, I think there's a consensus to move forward with opening the construction. There's a lot of detail yet to go through that John and our building inspectors, our ComDev directors will be working on. And I would support not a fixed timeline. I would support, they've got to determine the right timeline. And it could be later than April 23rd or 24th or 27th. But I think our town managers, our city managers, and our staff really will be able to guide us as to the capability within their own department to move this forward. So first, let's just get a sense of support for the construction industry. For board members, voting board members, could you please raise your hand? Okay. Tom, raise your hand.
I'm for implementing the 27th.
We won't pick, I don't think it's wise we set the date. I think it's wise that John Peacock and Karen be the people to set that date. That's when everybody's ready to go. Tori?
I'm supportive of the general idea. I am concerned about the details. You know, I really sit here in this seat, and I know you all do as well. Health and safety, number one. And Dr. Levin just told us that, you know, relaxing these restrictions will definitely show an uptick in cases, or at least tested cases or confirmed cases. You know, I'm having trouble just saying, yeah, let's go, and not knowing that really the structure is there. I was wondering, perhaps, given this direction, if we are to say, yes, let's start getting these guidelines and protocols in place, let's make sure that the sites and the contractors can keep up with us as well on this, that maybe we can give that direction today, but we should maybe review this next week to make sure that the safety protocols are in place that really give us a sense of comfort for our communities. I think we're moving really, really quickly on this in a good way. I do support getting back to business, but not early and not unsafely.
Marky, do you mind if I
yeah, go ahead.
Tori, I don't think anything would move forward without the full review and approval of the public health staff, who I think do have the expertise at this point to establish those guidelines, and then we'll be measuring. And so what I would encourage is every meeting that you guys have to review this is going to push this back another week. And so the real question is going to be for you guys is, do you know, in terms of a policy direction, I think what public health is saying is that we're ready to take an incremental step. And why construction makes sense is it's something that can be clearly monitored. We have permits on all of these projects. We know what all of them are. We can get the plans in place and monitor. So it's actually a really good test case for us to reevaluate the next steps of reentry, particularly in areas that may be more difficult to monitor. So I just offer that everyone wants to be safe. I think the expertise lies with the public health staff. I just offer that for the group.
So what is the motion on the floor?
Move forward with the opening of the construction business at a date that will be established by the city and the county, and our ComDev leadership and public health department. Greg?
I could make that motion. I did want to say that we're being monitored by a lot of people who are watching, and I'm getting questions live here. One of them comes from someone who says, we'd love to do temperature thermal screening. Can the public health department advise us where to get the equipment to do so? So let's make sure they have the ability to do the thermal screening, whether they're a construction site or a company. That may be one of the questions that comes up for us. And I do support moving forward this, and I would make a motion to. And also, I'm thinking, I want to, before this is finished, I also want to know how we're going to be prepared for this potential bump that we're seeing that Kim talks about. Karen mentioned needing 18 contact tracers, and I'd like to have a little discussion about that later on, so we know what does that entail. Who could qualify to be a contact tracer? What is it going to take to be able to meet that need? Because we may actually need that if we're going to be screening people, and you know, that may lead to contact tracing at that point. But there's my motion. Sorry to corrupt it that way.
Thank you very much. Do I have a second?
Second.
Sorry, Marky, Suzuka wasn't able to record that motion, so
Okay.
we'll repeat it.
Oh, Greg, it's a long motion.
Okay, well, my motion is that we approve this order. The discretion of the public health department and the staffs will be taken into consideration as they choose the date. And understanding that it does involve temperature screening protocols for every job that reopens, has to be fairly rigorous about that. I'll just leave it there.
I second.
Further discussion?
Yeah, Tori, further discussion?
Thank you. I'm struggling with this. You know, some of the data that we were just shown in the presentation very much today does not really support this. I want to know that the medical community and Dr. Levin are going to be in on this discussion with health and safety being our top priority. I'll support it going forward if I know that.
Can Kim speak to that for us, please?
Yeah, like I said before, my opinion in looking at the modeling and knowing what we see in the ER is that this will cause a rise in cases. We know that. We have to accept it if we make the decision to move forward and open things up. My recommendation is that we do not do it all at once, that we do it incrementally, and that we put more time in place so that this is done correctly and it's not an open door. And I do agree with Tori about thermometers and having a lot of systems in place before it happens. I also agree with moving forward because that's the only direction we can go. But again, it has to be very careful. And we'll have to have a lot of close communication, which we do have already with the hospital and with public health, and ways of tracking the bump and how big it will be, and how much of a risk we're willing to take. And again, the goal is to keep the hospital open and to keep everybody safe and able to take care of the cases that do happen as I mentioned and laid out before, that this affects everybody. This is not just, as we have seen originally, just a risk factor age group, that this can affect anyone, and that's kind of the dangerous part of this virus.
Well, I was going to assume that Kim would be part of those discussions.
Another quick question.
Yes, go for it.
Will the groups on the site, will they be restricted to 5 or less?
No, it's 10 or less.
Well, our public health orders is 5 or less.
So exempt, so just a reminder that exempt businesses are, they have, the group size is really geared toward events or people gathering together. So if you look at the state order, again, if we're trying to align with the state order states that businesses reduce their workforce by 50%. So that would be the guidance if you were trying to align with the state order, that construction companies would be looking at, they have to adhere to that site safety plan, they have to adhere to the social distancing, and if you wanted to align with the state order, they would be looking at a workforce reduction of 50%.
Okay, thank you for that. I mean, that is something that could be considered when we work out the details. And while I support this, I also support Dr. Levin's and Tori's comments about having a slower rollout and not open the door wide open right away. So.
Markey, can I comment, please?
Okay.
Whoops. Markey, can I comment,
I agree
please?
with Dr. Levin.
Wait, can I make a comment, please?
Oh, Patty, hard to see you there. Okay.
Thank you. You know, I think the process itself will incrementalize things. I think by the time applications come in, by the time they're approved, by the time jobs are geared up to start, we won't see everybody hitting the ground on Monday morning on the 27th. I think that it's going to take a while for it to unfold. And so that kind of slow opening will be created itself by the process that people are going to have to go through and the time frame it's going to take staff to approve, issue, get things going again, and for the projects to gear back up. It's not like a retail shop where you can open the door and the next day you're in business. You got to get those workers back and those subs lined up again. And this has been a huge hit to the industry because of that. So I think in itself it will incrementalize, and that makes me comfortable in moving it forward.
Okay, are we ready for a vote here? Okay, all in support, raise your right hand to the motion.
And this includes construction and landscaping.
I support cautiously.
Thank you, Tori.
Tom?
I'm off.
I will support cautiously as Tori.
Okay, thank you. Okay, Greg, you had your hand up. Okay, no, we're good to go. Okay, let's move on to the next topic, Karen.
Okay, so Zuha's going to bring up the next slide, or the same slide. Our next slide, yeah, we're ready for the next one. Okay, so now we're on to lodging. As you're aware, we had a much more strict part to our public health order where we actually closed down lodging, everything from hotels to bed and breakfast, Airbnbs, those kinds of things, except we made an exemption for essential workers and if we needed those facilities for isolation and quarantine needs. The state did not restrict lodging. Our recommendation from a public health perspective is that we continue to keep the current restrictions. And I will go back to the slide I had where our biggest risk in our community is destination tourism. One of the only ways that we really have to limit the number of visitors coming into our community is to, in essence, not have any place for someone to stay. So our recommendation is to keep this the same way we have it currently in our current public health order.
Any discussion on that recommendation? Yes, Greg?
I see Jeannie has her hand up also. I'll be brief. I would support what Karen is saying. I think if we start reopening lodging, it means we're open for business as a tourist destination. And
Right.
I think that's happening a little bit too soon. But I also believe that, as someone mentioned earlier, economic activity and economic health is a determinant of health in our community. And we really do need to look forward to it, but I believe it's too soon.
Jeannie?
And my point is, since we're opening up construction, why bring in this other source of infection at this point? So.
Yeah, one at a time.
Christina?
I was just saying, I agree, one at a time.
Yeah, one at a time. Okay, I think this one does have everyone's consensus. Do I have a motion for the staff recommendation to continue?
The motion to approve the staff recommendation.
Yes, on lodging.
Second it.
Okay, we have a motion, we have second. Further discussion? All in support, raise your hand.
Aye.
Aye.
Okay, moving on to the next slide.
We're getting there. All right, golf courses. So we actually did not give any guidance in our public health order in regard to golf courses at the time. Just to go through the state order, the state does allow for golf courses to remain open. There are some really strict recommendations around that, but just as we have here in Pitkin County, you can't have the restaurants or clubhouses or the pro shops be open, that they have certain criteria around tee times and how many people can be out on the course, that only household members can go in a golf cart together or caddy together. There are a number of different regulations that golf courses have put in place as far as like not touching the flags, or even where my mom lives, they have PCV piping around the hole so that the ball doesn't even go in the hole, so you don't have to pick it up out of the hole. So there's a lot of different mitigating strategies that golf courses can do. One thing that we know Garfield County is doing right now around golf courses is that they are restricting it to residents so that it doesn't become a destination kind of activity for people to engage in. From my perspective, from talking with different folks, and I'm going to have Sheriff DeSalvo weigh in on this as well, that there are, if you have a controlled environment in which there are, again, just like with construction, there's a site plan or a mitigating risk a document that golf courses are collectively putting together, that regulated environment is probably better than having a golf course be open to people just, we saw people last week, I think, playing soccer on the golf course, and that's probably, an uncontrolled environment, maybe more risky to disease transmission than a controlled environment where everything's very regulated and has some controls around social interaction. So the recommendation that staff would make on this is that we would align with the state order, and that there would be, again, sort of a mitigating risk document that the four golf courses would work together on and submit, and we would go through it, and then at that point they would be able to go ahead and open, knowing, again, that this is a recreational activity that can help people with their mental health as well as their physical health. And we really want to, encourage that as long as we have these stay-at-home orders and more restrictive things in place.
Joe?
I don't know if there was a specific question in there for me, except for the little bit of homework I did on other golf courses that have opened. I am on the golf board at the Aspen Municipal Golf Course. And Marty, specifically how this came about for me was, just like skiing, golfers get antsy as soon as the temperature gets above 55 degrees. And everyone was, out there playing when the golf course was closed, which usually is not permitted. But one of the things I saw the most was the other recreational activities that Karen described, the soccer, Frisbee games, people riding their bikes. It actually looked like to me that there were more people out there when the golf course was used as a park than there would have been if there were people out there just playing golf and have it used as a golf course. And I think it could be easily controlled by that. You know, some jurisdictions, as Karen mentioned, are doing 40 times an hour, walking only, no carts, pass holders only. It would be local members only. But I think that's a decision for the city of Aspen. Whether or not to open it, I think that goes back to Karen's public health expertise.
Thank you, Joe. Any questions for Joe or for Karen?
I guess I should ask a quick question on behalf of the city of Aspen. I guess what this does is this returns the control over a municipal golf course to the municipality. This is not a mandate for opening. This does give us the ability to open, correct?
That's correct.
Thank you.
And would it go for private golf courses like the Snowman's Club?
Yeah, I would say the same thing, that they have, you know, I think all these agencies have the ability to have autonomy over decisions. This is just that it's not restricted in the public health order, or it is exempt in the public health order, that we're saying it's okay if you have these things in place, but if a golf course decides that they don't want to open for their own reasons, that's also their choice.
Okay. Do I have any other hands?
Well, just.
Tom, you're muted.
Not anymore.
Okay, no. You're muted. Brent?
Oh, it was just quickly that this seems like a reasonable step towards normalcy, and the density on a golf course, especially with a few restrictions, is pretty minimal. It's outside, it's not confined, it's not inside, and I think it's we have to move forward in some incremental way. We have to move forward, so I think it's a good idea.
Joe, I would assume that you would not be opening the restaurant.
I think that was for me, Marky. Yeah, I think most courses are not opening pro shops or restaurants. It basically is like a walk up to a window, swipe your card, nobody touches anything, and you go off and play. They are discouraging any gathering, no driving range, no putting. You get out of your car, you get to the first hole, and you start walking. I also think that, you know, if it was under normal conditions, I'm not sure the course would be open before May 1st anyway, looking at today and other days. So I don't think we're that far off track than any other regular opening. But I would have to suggest that I do think there's a lot less people on the golf course when it's open than it is when it's open as a park.
Thank you very much. Any other questions? If not, then I will entertain a motion. Greg?
I'll make a motion to allow golf on golf course activity based on the staff recommendation and what I've just heard from Joey.
Okay, all support, raise your hand.
Sorry, we needed a second motion, Marky.
Second.
Oh, I'm sorry.
Christina second.
Further discussion for 1 second. I'm going to support this, knowing that the city of Aspen has municipal control over its golf course, so we're going to be doing what we feel is best and safe in the interest of our community.
Okay, thank you, Tori. Greg, did you have another?
I would just say that I did want to have a conversation about masks and use of masks. We have recommendations about uses of masks. As long as we notice it everywhere that masks are essential, I think that's going forward. That would be part of it. Frisbee scares me on golf courses, so I think this could actually solve some of those problems. And I liked Karen's suggestion about the PVC pipe or some sort of barrier to the hole itself.
Okay, Kim?
Just a quick question. So all the details are going to be worked out later in terms of restricted to residents only, what's open on it, how it's used, all of those details. This is just to okay going forward. And I agree with Brent. I think it's a low density place, and if it's done correctly, I think it may be one of those industries that's really worth opening.
Thank you.
Okay. Any further discussion? If not, all in support, raise your hand. Anne? Oh, I'm sorry, you're an alternate. So I do have support to move forward as staff recommendation. Let's move on to the next slide.
Hold on. Okay. So Sue has like doing 3 things at one time, so.
A woman of many talents.
That's right. Okay, so now we're on to retail. So as you're aware, in our order, we had exempted some businesses as essential businesses that they could operate during this, the public health order. There's a couple that have come up that we wanted to recognize were a little different. So in general, our exempted businesses are very similar to the state order, but there are a couple that have percolated up that we wanted to bring to your attention. One of those is that bike repair, just like car repair, was exempt in the state order, recognizing that for some people, bicycles is their primary form of transportation, and if they didn't have access to bike repair, they might not be able to get somewhere like to work. And that was just, I think probably a little bit of an oversight in our first order. And the state really did exempt bike repair. What they didn't exempt was bike retail. So it's not like you could go out and open your full bike store and be selling bikes, but certainly having the bike repair part of your store would be exempt and be allowed to operate. The other place that we didn't really think about was office supplies, and that really could be, for someone who's working at home now, they might need access to office supply store or something like that. So we haven't really tussled with office supplies, but we're recommending that we include bike repair and office supplies stores as critical businesses, and that they would be exempt and be able to be open for those purposes.
Okay, Anne.
There we go. I support this, and I've spoken with the bike shops in town, and I do consider bikes, particularly in Aspen, as essential for transportation, especially with RAFTA. RAFTA servicing decreasing so dramatically. The shops got together and put together a safety protocol. I think that was part of the package. That might be beefed up a little bit, but they have been very conscientious in trying to be as safe as possible and social distancing. So I do support going ahead with this. And thanks.
Further discussion. Okay, I'll entertain a motion. Tom?
I move that the implementation be derived as written in the order.
Okay. Greg, are you?
Second.
Yeah, for further discussion, I'd just love to see the slide up again once you've got the vote. Just wanted to take a look at the slide again. But I think Christina just seconded. That's fine.
Okay. Okay, now I can't see anybody, so go ahead.
Okay, for further discussion, if I could, this is Tori, I'd like further discussion. I was just trying to pull up this item on my agenda. I had to try to get it on my phone. What's the et cetera? I see bike stores, office supplies. What's the et cetera?
Sorry, Tori, I'll have to hyperlink over to that. Give me a minute.
I'm sorry about that too. I'm trying to get it up.
No, I'm just thinking of the iPad store in town, like where the iPro Center, that's what I'm thinking, et cetera, should mean, but
Yeah, Tori,
office supplies are.
I may be able to shed some light on that. I think it was just there are other kind of retail functions that are listed in the state's public health order related to retail, most of which don't apply to us aren't a real change. The real changes were the office supplies and the bike shops. For example, the state exempts firearms shops, which if we align with the state, we'd be exempt. They would be exempted as, but that doesn't matter because we don't have any that I'm aware of anyway.
So in talking with Karen yesterday, as we prepared for this meeting, I have several dogs that need to be groomed. Could I get my dogs groomed? The groomer is a one-man show.
All right, sorry, Mark, are you wanting to make a recommendation to add dog grooming?
Dog grooming because the exemptions are open. The Aspen Animal Shelter is open. I know they've got a great dog grooming business because I know it. The point is that it would be essential, what I see is important to the owners of pets.
Yeah, I don't know. I don't think that is an exemption in the state order. I know generally shelters absolutely are, and I can't remember the language exactly in the state order. I'd have to pull it up. But I'm pretty sure it's more around the maintenance and care of animals rather than, well, I guess that could be considered maintenance, but I think it's more around the necessities of taking care of animals rather than around the grooming. So I don't know if I have any recommendations for you right off the top of my head around that. I just think we have to be cautious of, you know, the interaction maybe with the groomer and the owner of the dog, because there might have to be close interactions and passing the dog off. I don't know, but I haven't really thought through that, and I don't know what the state says off the top of my head.
Then I'll hold on that till I look at the state order. Okay, so we have a motion on the table relative to bike shops and office supply. We've got a motion, we've got a second. All in support, raise your right hands. Okay, thank you very much. Let's move on to the next slide.
Okay, we are on to places of public accommodation. We had stated that this is sort of around a food component, that restaurants could provide takeout and delivery of food for sale, and packaged alcohol, as long as they were maintaining the distancing as per the public health order, that you could allow 5 people in an establishment at one time. I think what was not clear maybe in our public health order is that when we talk about a restaurant establishment, we are talking about both inside and outside. That is all of the restaurant, and I think there's been some confusion in the community that patios may be exempt, but that is really not the spirit of this this part of the public health order. We are saying that, you know, someone could walk up, and as long as there's, you know, a social distancing in line, they can pick up food and they can take that food back to their house because there is still a stay-at-home order. I think there's been a perception that someone could sit out on a patio and have their takeout there. That is still considered part of the restaurant, and should be, in essence, not, you know, all chairs and tables should be put up. There shouldn't be anything on the outside or the inside for people to be able to sit. And so I think there's some confusion in the community around that. We don't want to necessarily, we say keep the language the same, but I think if there's confusion in the community that we need to add that a restaurant includes outdoor patio as well as the indoor seating, then that would be a recommendation we could, I could make to you, and you could potentially change if you feel like that's an issue.
Thank you, Karen. Discussion? Okay. Yes, Jeannie?
Sorry. So Karen, if there's a public bench maybe 10 feet away from the restaurant that's not part of its patio, then the public are welcome to sit there and eat? Is there a distance requirement?
Yeah, I mean, I think that, you know, in the spirit of the public health order, which is the hardest part of all of this, right, is that it's the intentionality. So if a restaurant left their tables out and then made it a comfortable place for someone to be at that table, you know, that's not really in the spirit of the public health order, in which we're trying to say, again, the overarching goal of the public health order is to keep people apart, right? So that they're not spreading disease. And so when people have the opportunity to cluster on a patio deck and kind of not really comply with the stay-at-home order, that's not really in the spirit of the public health order. Now, if someone decided to, you know, go have their lunch on a picnic table in a park, you know, is it a violation of the stay-at-home order? You know, we're trying to encourage people to get outside and be healthy outside, you know, and so I think that's just such a tricky little place to go. I think in regard to restaurants, it's that we don't want restaurants encouraging people to sit outside in clusters waiting for their food, or to sit outside in clusters after they get their food. So I don't know if that completely answers your question, but.
Okay, do I have a motion?
I'll make a motion to approve the continuation of what the current policy is and to not make any changes.
Okay, do I have a second?
Second.
Thank you, Tori. Any further discussion? All in support, raise your right hand. Okay, it passes unanimously. Next item. Karen?
I'm not unmuted, sorry. Now I am. In the last public health order, you know, per guidance from Dr. Levin and the medical community, really recognizing that, again, one of our highest risks is people coming into our community, especially when we had a really strong recommendation in the last public health order before that, you know, visitors, if you're here, we really want you to go home in a safe and most effective way. And if you are not a resident of this community, that you do not come here right now. And that was really a reflection of a number of different things. So a reflection that we don't want to overburden our health system, and the more people we have in our community, the bigger potential that's going to be. That being at altitude is not a great place to be in relation to COVID-19 in general. That resources beyond the healthcare system, so just like groceries, are also, you know, in limited supply. We've seen supply chain issues with all sorts of things, or, you know, people kind of hoarding things. And so we don't want to put a strain on our other resources like grocery stores or other places of essential service. And then finally, you know, if you did come here and you weren't a resident and you did get sick, you don't have any of the social supports that you might have back at home. And so there are really some strong reasons to protect people's health of actually coming here, and protect our community's health around resources, and knowing again that travel is one way that this virus spreads pretty rapidly. We went ahead and put in a quarantine order that said, you know, if you're friends, family, and guests returning to, you know, they're returning to or coming to, I guess, Pitkin County, like non-residential, sorry, what? Second homeowners is what I'm trying to say. Second homeowners that may not be permanent residents in Pitkin County, that you would be required to quarantine for 14 days to protect the community from the spread the virus if you happen to come in symptomatic. And that really is also in reflection of like, we're really asking visitors, like, please come, but not right now. This is not a good time to visit our community. And so it's kind of a reflection of both of those things. The state order does not have any quarantine requirements. Our recommendation is that we continue to keep this quarantine requirement in the public health order for visitors coming to our community.
Thank you, Karen. Okay.
Can I just add quickly to that, to Karen's remarks? I fully support continuing that as well. And just to remind everybody that there are very big surges happening in Miami, New Orleans, Chicago, across the nation, and this is happening right now. It's not just New York, and it will continue to happen. So I think we really need to protect ourselves on an ongoing basis.
Okay.
I'll make a motion to approve.
Okay. Christina, did you make a motion?
Yeah, I'll make a motion to approve that we maintain the same policy for out-of-towners to be quarantined for 14 days.
Okay.
I'll second it.
Okay, Greg, we got a second. Further discussion? All in support, raise your right hand. Okay, unanimous. Brent, thank you. Motion was unanimously approved. Okay, next item. Karen? Karen?
Yeah, sorry, 1 second. We're just pulling it up. Okay, so we kind of tussled with this already as far as dates of change. I don't have any, this is just a generalized recommendation of when we actually put into effect the changes of the public health order. So that's really what this is about, because eventually I have to change the language and then re-sign the paper and put it to it. So that's really what I need from the board on this last piece is what date do you actually want these changes to be put into the public health order?
Okay. Question, could we have, let me take a stab here. You have the 23rd. I would say that we could do that for perhaps the bike shops, office supplies, and no later than maybe May 1st for construction. Can you do anything like that, Karen?
Well, I can do the first part. I think the thing is we have a public health order that is set to expire on April 30th. And so obviously there's going to be a lot of, I sort of mentioned this in my presentation up to this point, is that we have some data that we are collecting around those criteria of when to lift, when to do the longer term strategies around easing of the suppression. And so if if we're trying to align with the state, I think the state of Colorado is going to continue their stay-at-home order, but we don't really know exactly when that is going to be determined or what that date is going to be. So the state is saying that in 5 days, they'll have the data that they need to be able to really think through that. So my recommendation is that if we think we're wanting to give construction a little bit more time, then maybe when we do the revision of the public health order for the May 30th date, that we consider construction at that point, and we make all the other changes more effective more immediately, if that makes sense.
I think that makes a lot of sense. How about the rest of you?
Quick comment.
Yep.
Thank you. Karen, I really want to thank you for that last comment. What's important here is that today is April 16th. We are in the middle of the week where we had predicted a spike in cases being reported and a spike in other indicators here. So I really do appreciate that that this would not go into effect at least for one more week while that data is being collected. So that part I really do appreciate. The second thing that I want to say is that I think what Karen also just outlined is really in accordance with what we're feeling as the Board of Health. What I mean by that is that this is not a lifting of the stay-at-home orders. This is just including a few more avenues, for example, bike shops, something that's important to people's transit. So we are just allowing a few more uses under these essential businesses and easing some restrictions. But this is not the end of the public health order or the stay-at-home orders or any of the social distancing measures either. And I just wanted to make that clear so that the record shows that, and for those that are watching, understand that as we're moving towards lessening some of these restrictions, it's just in very specific areas that we're considering them. So thank you, Karen.
Yeah, that's exactly it, Tori. You know, we're talking about some things that have sort of risen up since the last public health order. Like I think the bike shops is just such a great example because, you know, it's probably just a miss on our part to not include bike retail or bike repair at that time. And so this is, you know, in essence, kind of tinkering with the current public health order. Certainly the bigger component of the public health order, the stay-at-home part, you know, in particular, in some of the other issues, the essential services, there's a lot of analysis that needs to be done and a lot of data and criteria that we really need to be able to work with the hospital and on our epidemiological team to better understand where our community is. And I think the state, you know, is doing exactly the same. So that, I feel like that's the bigger conversation. And as you clarified, we're not really talking about the bigger conversation right now.
Okay. Any further discussion? If not, I'll entertain a motion.
So moved. So moved.
Okay. Do I have a second?
Second.
Okay. Is the motion clear to everyone? Okay. Karen? Did you understand the motion?
Sorry, so actually maybe I do need to ask for clarification. So we're saying all of the components except construction can be opened or changed for tomorrow or for the 23rd. And then the second part was that we're going to wait for construction to really be opened on the 30th or the 1st. Is that, I may be confused actually.
You have it right.
We already voted
Okay.
on the 27th. Marky?
Okay, we have a motion on the
Wait,
table.
Marky,
We have a second. Any further?
Can I just have a point of clarification? I'm sorry I had to step out of the room, but I thought we already voted on the gearing it up for the 27th. Did we rescind that vote?
Basically, this would change that vote.
So we're not.
It was not date specific.
So now we're.
It wasn't date specific.
Yeah, well,
the 27th was not.
Well, my understanding of that first motion was we were leaving it up to staff, discretionary by staff, and if it could open on the next week on that Thursday or the Monday the 27th, then we were good with the Monday the 27th being the start date for construction. If they had gone through the process with submitting their plans that were then certified or verified by the community development departments. So now we've changed that. Because people have already calling me, thanking us for doing it on the 27th. Now we've changed it to the 30th.
That's when the public health order, our public health order would no longer be in effect unless we extend it.
Right.
But, construction.
Right, I understand that, but we're changing it to add these other retail, and I thought we were changing it to address construction and landscaping to allow them to move forward possibly as soon as the 27th, if they had all the documents submitted to community development. Is that still correct?
Well, my understanding and talk was what Karen suggested was we would make these into effect, the construction and landscaping effective with the lifting of the public health order to the 30th.
So we're retracting the vote you guys already took to allow it to move forward sooner than that.
I think Patty's right. We're probably going to have to rescind that previous vote we took, or unless we stick to that. And you know, I think we've added too much in here. Sorry.
And let me just ask a clarifying point for all of you. So I guess what I'm I'm getting at the kind of the technicality around this, and in that when I go back to revise the public health order, there's a date, and that date says, with my signature says, as of this date, this new health order is in effect. So it makes it a little hard for me if I have, one date for one thing like bicycle repair and another date for construction. And so, and regardless, I could sign the paper tomorrow. Construction theoretically could still have as much time as they needed to amp it up. So I think if you can just think about what's the best date for that public health order to go into effect for all of those things, and maybe it's that compromise date between the 23rd and the 30th, so maybe it's the 27th. I'm not trying to make this harder, but ultimately, every time we change something in the public health order, we have to amend it, and it becomes a new public health order. So as much as we can have everything happen at the same time is helpful for me.
Right, I understand that, but you're amending it to address the retail already. So you're amending it so retail could start tomorrow. They're not part of the public health order now, so you're already amending the public health order to add retail. So I don't get it. So either we're gonna have it all start on the 30th or we're not.
No, that's not what we're saying at all.
But she just said
How
it would
about
be
we let the
better to
board
have a
continue
consistent
further?
date.
Marky, this is Suzuho. Just for clarification, as I'm taking minutes here, John Peacock had mentioned that April 27th date for some of the information to come from the ComDev efforts, but that date was not in the motion that was made and voted upon. So just want to clarify that.
Okay, thank you, Susanna. No, it wasn't. Tori?
Thank you. No, that's what I was saying. I don't believe it was date specific. What we did was we allowed staff and Karen and the Board of Health health experts to be working on that. So I think where we sit here right now is staff's recommendation of updating the health order effective the 23rd, but that doesn't mean, but construction will still have a process to go through from there. So it is potential that they could get started, I think, even on the 27th is the direction that we have already given.
Right.
They could get started there if the county and Karen's team have got those protocols in place. That's my understanding as of right now.
Yes, we gave a flexibility. John Peacock, did you have anything to say?
Why are we voting on the 30th?
Yeah, so I understand that this is a little bit confusing. I think an option for the board, I think what Karen is asking for is to be able to amend the public health order one time. And so I think we can choose a date for amendment of the public health order. As it relates to construction, that is going to rely on us having the COVID safety plans in place anyway, because construction will not be allowed to begin until those COVID safety plans are begun. So even if it's included, for example, if it's included as a April 23rd start, which I think was where we started with the slide for everything else, I think what it would be dependent on for construction then is having the process in place to receive and process the safety plans for COVID. And so I think if you want to look at your start dates for the other elements and let Karen do one amendment to the public health order, and then we can communicate to our partners in the construction industry when the testing plan will be in place.
That's a very excellent point. Yeah, Tori?
That's what I was saying, and that's what I support.
Okay. So do we have a motion coming from someone on our board regarding the staff recommendation on the 23rd?
I would make that motion for the public health order to be the new amendments to the public health order to be instituted on the 23rd.
I'll second that.
I have a second. That's Greg Postman. Further discussion? Okay, all in support, raise your right hand. Okay, thank you. Karen, next.
Okay, so Charlie was waiting so patiently, but we do not have time for the epidemiological presentation. 3:30, and I know that the BOCC room is now being booked for a ASE meeting, so we actually probably need to terminate our meeting. We will get Charlie on your agenda at some point because he has some really fascinating epi data to share with you about our community that will help you to make informed decisions in the future.
Greg?
Thank you. I understand that we need to wrap this. I did want to bring up one thing about public noticing for emergency meetings. In a public health crisis, you can imagine the Board of Health needs to meet more often. I know there's a 3-day, I believe, waiting period for a public notice period. Can we amend that? I'd have to ask John if that could be amended to at least match the public notice for the BOCC, which I think is 72 hours?
24.
Sorry, so Greg, it's 24 hours notice, so we have to notice it 24 hours in advance. We got stuck in just a process piece around that this last.
Okay, thanks for clarifying that, and also I'm certainly open to more frequent meetings if necessary in a public health crisis, and I also like having enough time to get through everything. I'm sorry, Charles, that we're not going to get with you today.
Yeah, I was really looking forward to that presentation, but needless to say, this was a very packed agenda, a lot of good decision-making, a lot of great discussion, and I really want to thank Karen and all of her team, and I want to thank John and all of his team. So I think we're starting to move forward. One of the things I noticed yesterday from Polis was, and I think we need to we need to diminish the expectation of having large community events for this summer. It's hard to swallow, but on the other hand, we do not have adequate testing yet, nor do we have a vaccine. So in hearing that, yeah, I see the clock. Hearing that from Polis was extremely helpful. And with that said, I'm going to go ahead and adjourn the meeting. Thank you all. Good work.
Thank you. Thanks,
Great
Ken.
job, Marky. Thank you.
Thank you, Marky. Thank you, Karen.
Thank you.
Thank you all. Thanks.